All right, we do have an elected official who wants to meet with us, one of the leaders in the California State Assembly. He's from the 40th Assembly District, Bob Blumenfield.
Thank you so much for allowing me to be here. I heard one of the previous speakers mention the Sheila Kuehl bill that had been passed by the legislature but then vetoed by the governor. There are those folks out there who think that because of term limits they can just outweigh us supporters. Well, I was just elected 128 days ago, and I'm here to say I am just as committed to single payer. And I will fight with you and with everyone else to make sure we get single payer. Healthcare should not be a privilege. Healthcare should be a right. And we need to get it done, either on the state level or on the federal level, but we need it here, and that's my only message to you. Thank you so much.
Thank you, Senator Blumenfield. All right, our next speaker, he knows a little something about the health insurance industry and how they're trying to get a bailout every time. Right? We've got to stop that insurance industry bailout that they're contemplating in Washington, D.C. A longtime advocate for single-payer health insurance, the Lieutenant Governor of California, John Garamendi.
Are you ready for a change? Are you ready for a change we can believe in? Are you ready for a single-payer universal health care program? Well, let's make it happen in America! Do you have a voice? Are you ready to raise that voice? Are you ready to raise that voice for a single-payer universal health care program? Oh, I love the sound. Okay, back off. I know a little about the insurance companies. I was your insurance commissioner for 8 years, and I know the insurance industry, I know the health insurance industry, and I know that they have but one purpose, and that's the bottom line profit. As long as they are in this game, America will continue to be ripped off. And it's time for us to end that with a single-payer, universal health care program. And H.R. 676 is the way to get it done. So how are we going to do it? We're going to make our voices heard across America, and we're going to come to America with some information. One third of every dollar that's spent in America on health care is spent on administrative costs. Why, you ask? Because the insurance industry manipulates the system so that they do not have to pay, so that there's an administrative chaos, so they can deny claims, so that they can push people aside. And I'm telling you, it has to end, and it will end with H.R. 676. 41 years ago, America figured out how to solve this problem. 41 years ago, America created a single-payer, universally available health care system that covers everyone who is over 65. That policy allows you to choose your own doctor wherever it may be. That policy allows you to have a comprehensive benefit package. We know how to do this, America. All we need to do is to take the 65, erase it, write in zero, and send your premiums to the Medicare office. Now that's change we can believe in. Now that's change that America needs. And that's change that will give everyone in this country a benefit package that they can believe in. Are you ready to make it happen? It's going to be a fight. We're up against the most powerful of all the insurance industry. The health insurance companies will not let go of their bottom line profit. It's going to have to be ripped away from them by Americans that are fed up. It's got to be ripped away from them by you and people like you all across this nation that are willing to say, enough already. We must have change, and we must have it now. This is a fight worth making. This is a fight that we must win, and we will win it because you are in the streets, because you are willing to stand up and say, we must have change that we can believe in. H.R. 676 will be, it must be, and it ought to be on the table. Make it happen.
Thank you, John. Wouldn't it be great if John Garamendi were the governor of California? All right, we have to stop the insurance industry bailout because it is literally a matter of life and death. Our next speaker knows that. She knows it all too well. It is a great honor to have with us today Hilda Sarkeesian, whose daughter Nathalie was a victim of the health insurance industry. Hilda.
Thank you. Good morning, everyone. I want to thank CNA for having me or giving me the opportunity to be here with you guys today. Thank you.
CSEA is also in the house.
CSEA also. I have a real story to tell you. For those of you who don't know me, my name is Hilda. I'm Nathalie Sarkeesian's mom. On December 20, 2007, my daughter, my angel, passed away because of Cigna, our insurance carrier. We thought we had insurance. We thought we were fully covered. I have a message to Arnold, our governor. Before you stepped in our office, you promised all the American people you cared about them. You were not going to raise any taxes. You were not going to raise the vehicle registration taxes, the fees. And guess what? Now you're trying to put something that's not going to work on the table in front of our president. That's not going to work. Our president is smart. He knows. He loves his people. And he's going to do it. And he's going to do it right. He's going to go for H.R. 676. The American people don't have jobs right now. People are being laid off. People are losing their homes. I've been in real estate for the past 19 years. I've never seen it this bad. And you are going to put something on the table that American people are not going to be able to afford? That is wrong. Our insurance companies are good for collecting our dollars. Insurance companies deny for our coverages for their pocket, for their profit. Insurance companies deny doctors' requests for life-saving treatment, like our case, my daughter's case, Nathalie.
Yes, they do. Right.
Insurance companies are getting away with murder.
Yes, they are.
Every time insurance companies deny, guess what? By the end of the day, they make money, and their CEO makes billions and billions of dollars every year. And let me tell you something else. Around Christmas, when my daughter passed away, he makes $3 million as a bonus. Why? Why can't he say? That's right, that's right. Now let me give you another example. In 1915, Armenians were massacred by the Turks. We never forgot that. It's going to be 94 years. And guess what? I will never forget what insurance companies did to my daughter. We'll never forget that. This is going to happen to you, every one of you, if we don't stop them right now. We need to stop them, your children, your grandchildren. And let me tell you another thing. All the politicians, everyone else is going to need hospitals, is going to need nurses. How are they going to face you guys? Right?